and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I am delighted to have a screen full of people joining me. Today we're going to be talking about the Collaborative Supportive Outreach Program, which is a pilot program that's operating actually here in Owen Sound, but certainly hopefully in other areas to expand. And the group that's joining me today, I'll go through the formal introductions, but if I get your titles wrong, please correct me, because I know things do change, especially as we're moving through COVID-19. So in no particular order, although I'll go to Kevin first because he's on my right side of my screen. So Kevin McNabb is the Director of Paramedics Services for Grey County Paramedics Services. And Francesca Dobbyn is the Executive Director, United Way, Bruce and Grey. Stephanie Burley is the Program Manager, Addiction Services, Canadian Mental Health Association, Grey Bruce, Mental Health and Addiction Services. And Robyn, and is it Nocilla or Nocilla?
Nocilla.
Nurse Practitioner, Grey Bruce Health Services. Thank you all for being on the program today. And I'm wondering who would like to go first and explain what is collaborative support, a supportive outreach, and what do you do?
Well, I can talk a little bit about
somebody. All right, Stephanie, you go.
I can talk a little bit about kind of, I guess, the origin story of this project. Yep. So in summer of 2021, there was a COVID-19 outbreak at a rooming house in southern Grey County, where a group of about 30 to 40 people were required to quarantine. Once that was announced to them, quarantine started, it became evident that they were going to require a lot of support from the community in order to quarantine safely and successfully. So a ton of community agencies came together. I don't even know how many different agencies there were, but I'm going to say over 12 from all across Grey and Bruce came together to meet these individuals where they were at and bring services right to their door so that we could keep them safe while they were quarantining, and then keep the community safe so that people wouldn't need to break that quarantine to get out and get things. It was really eye-opening, to see how challenging it is for individuals to quarantine if they don't have the adequate supports that so many of us have. So it was incredibly successful, and what we saw pretty quickly were impressive health and social outcomes by being able to provide that on the ground, on the spot support to individuals who I would argue would likely have engaged with a number of the services prior to, had they been able to. So it wasn't for a lack of wanting to, it was really, I think, an access thing. So being able to bring services to people allowed them to access them, take those barriers away. And like I said, we saw some really impressive outcomes. So towards the end of the quarantine, the residents there requested that we not leave them, that the support continue. And out of that came this supportive outreach services, or SOS, starting as a Wednesday, every other Wednesday in Hanover and Owen Sound, providing support, and then moving on to what's now this pilot project where the group is traveling throughout Grey County to provide that on the spot, on the ground, the right support with the right people at the right time.
So we all think of COVID as it's been just such a challenge, but out of COVID, an opportunity to create a new approach to meeting people at need is almost a silver lining to a terrible pandemic situation. And I'm assuming from what you're saying, Stephanie, this approach had not been used in Grey Bruce before. The services were provided to people, but people would come to the services rather than, am I understanding this correctly?
Yeah. So typically, all these services, nothing's new in terms of the services we're providing, really. It's just how they're being delivered. And the services that we're providing now through the SOS program really kind of take those extra barriers away, and make it more accessible for folks who were less likely to access our more traditional, say, office-based services previously.
So I see different people with different roles in this picture frame. Maybe you can describe what you do and if there's others involved as well, because there's quite a mixture of roles. We've got Paramed, we've got United Way, addiction services, and nurse practitioners. So it's quite a mixture. So maybe you can talk a little bit about what you do in this, and also are there others as well?
Sure, I can take that one, Carol. So being on the SOS program, really there's three individuals within the EMS transport, and then we have another individual that works as a team of 4. So we have a community care paramedic, we have a mental health and addiction worker from CMHA, we have a social navigator from United Way, and then we have myself as well as 2 other nurse practitioners that tag each other off, looking at on-the-site addiction management and primary care. So the idea is to take basically all the services that you would provide to a vulnerable population and provide them at the door at the time in a format that is recovery friendly and supports harm reduction and recovery language. And for a lot of people, that doesn't make a lot of sense. So what that means is that we don't force treatment. We offer aspects of treatment, but we do so in a friendly manner that allows patients choice. So if their choice is to use, but they need education on how to use safely, we do more of that chronic disease management. If they have wound care, or they need antibiotics, or they need assessments for blood pressure, we can do that on the spot. We can do blood work on the spot. We're seeing things like prenatal visits that haven't been able to attend, or that women are not aware of, because we know, unfortunately with women in rural communities, there is sex trade, unfortunately, and there is also where individuals are being forced. So being able to provide that safety in terms of testing and in terms of support around that from a mental health perspective, connecting with essentials of daily living, what we take advantage of, our house, our food, our clothing. So many individuals, especially with COVID, don't have that, right? And so United Way and having that partnership with them has been vital in this program, because that navigator, that person that we have, her name is Sandra, she's lovely. She is that person that is our go-to, when we need something in a group, she will help navigate where that is. And I hope Francesca is going to talk about, the funding that's needed for that, because obviously with a pilot project, funding is few and far between, and the need is really, really strong in our community right now.
So Robyn and certainly Francesca and Kevin will make sure we get to you, absolutely. But is it a van that goes from place to place? Maybe you can exactly say how and where people go to get the services. Where are you?
I can take that if you want, Robyn. So we actually use a Grey County paramedic ambulance. So what that gives us the ability to do is we have a place we can see somebody, there's a stretcher, we can carry our equipment. And with the paramedic there, if there was an emergency response, that they would be able to respond to that. And even the team themselves, if there is an emergency call for an overdose or any type of situation like that, or a mental health crisis, they actually can attend. And so they'll be aware of the call, and the team, they don't respond on an emergency basis, but they do attend and support the bystanders around there.
One of the things, and Kevin, you and I have had the opportunity to chat before, which has been wonderful. I'm just so amazed by the expanding role of paramedics as a result of COVID-19. And I'm wondering, before we go to Francesca, if you can talk a little bit about the role of paramedics and all that you offer, especially in this program. And what you're hearing back from those who actually are on the ground providing the service.
Yeah, through COVID, paramedics have expanded the scope that they offer as far as care goes. Primarily early in the pandemic, we were doing testing in outbreak situations and vaccinations, providing care for people that were, homeless, transient, or being, put up in motels to do general health assessments that may have been suffering from COVID. The paramedics themselves, they've been so great to be able to take, these roles on and, deliver this care. And through the work with SOS, it fits nicely for us because through delegation and directives, we need to work with the nurse practitioners and physicians to be able to delegate to us. And through this program, we work with the nurse practitioner, as far as the medical directives under them to more or less extend the care that they do and help, do the work that they do. So it's a really, these are complicated tasks. And what I found is like, it's really about working together because that's the best way we're going to be able to tackle it.
So it maximizes the use of the resources. I mean, there's only so many nurse practitioners and, obviously every service is strapped for help. So by working together, you're able to stretch those human resources and be able to provide the service. So let's talk dollars. Francesca, I'm going over to you. And also about the role of the navigator. And is that a new role for United Way?
It's a new old role for the United Way. We're the 211 of connecting communities together and community resources and agencies and information. And when Kevin asked us to be a part of this, because we were on the ground in Hanover within hours of everyone else, and when we were the gophers. I think of us as the gophers for this. So, we have the socks, we have hygiene supplies, but then we run out and we buy prenatal vitamins because that's not covered by anything. So in some ways we try and fill the gaps. So when Robyn and Kevin's team are talking to people and, there's something, they don't have a good winter coat, then Sandra will head off to Value Village and see what she can find, be it, we pay for it or if it's donated through one of the thrift stores. But also the secondary piece of that is introducing the people we're working with to those services. So if people are saying, I don't have food, well, here, let me do a hard introduction to the local food bank. And if you've got specific food needs, we'll have that conversation as kind of three people. So you can ask for that and that, you're not going to be shy about asserting what you need from that service and making that introduction. And if, the service itself is a little nervous because they're not used to working with people who have substance use disorder, demystifying what harm reduction is, as well as understanding what the needs are. And quite often, Robyn will have things like first aid kits to give to them. So she'll treat that primary care wound need from somebody who's outside a lot. And then they need, polysporin ongoing and a couple of Band-Aids and that kind of thing. So that's where we come in. We're fundraising for that. We've had some seed money from the Community Foundation, which we're very, very grateful for. But people can go to stufftheyneed.ca and make a donation to support the work that's happening around this. It stays with this project. We've bought boots, we've bought shoes, we've bought coats, we've bought a hoodie. It's meeting those people because it also builds trust that when you come to us and say, hey, we got a problem and we can work together to solve, and we have solved community level problems as well as individual level problems because we come together and we talk about all of these things as a group as well.
So again, can you say where people can donate
Stufftheyneed.ca.
Okay, want to make sure I get a double plug in there for the donations.
Carol, can I give a plug to this as well, just quickly?
Yes.
Like I've had a lot of learning through this myself since last June, and I've always known it about social support and the importance of it, but I've lived it now since June, and I've had a good education around it, like with the team here, like Francesca definitely, and a lot of other organizations that do that social support. Like in health, sometimes we think that we're number one and we are out there delivering health, but I think sometimes we have it a bit backwards because people really worry about the social side of things. Do they have a coat? Do they have food? Do they have a place to live? Their blood pressure right now is not the the number one thing. They need to stay warm and eat. And I think it's so important that we recognize the importance of that. I definitely have changed everything that I think about as far as that's concerned, and I really hope that everybody does as well.
And that's an important message. Francesca, you were saying about the basics, and as you were running through the list of what you do, and I'm thinking these are everyday living activities that a lot of people just take for granted. You know, they just take it for granted, but we're dealing with survival for people right on the grassroots, which I also think by being present and providing the service, the community becomes educated. So it's as you say, Kevin, certainly from your perspective, but I think even just the community being aware that there is a need, because there is a paramedic vehicle there that's providing service. Francesca, you mentioned a hard introduction. Can you explain what a hard introduction is and why it's so helpful?
So for me, a soft introduction is for me to say to you, hey, give Stephanie a call. Here's her number.
Okay.
A hard introduction is me sitting down with my phone and holding my phone and go, let's call Stephanie together and see what we can do. And that's that hard connection. We do spend a lot of time telling, oh, just go here, and then go over here, and then go up there, and then take the bus over to. And, that's overwhelming. It's overwhelming for us trying to keep track of where we're sending people. So it's about that navigation, and it's about vouching as well and connecting people. So when we're in Owen Sound and somebody brings a unique need to us at the outreach in Owen Sound, we'll say, are you connected to Safe and Sound? Because it may take me a day or two to get it there, but we'll drop it to Safe and Sound because we want to maintain that connection to that outreach service so that they know that's a place I can go and I can get supports from, and it creates that relationship building. And we've seen that with people of, those that we started seeing in November here in Owen Sound when we started the Owen Sound outreach, is they're bringing their friends. This is a place you can come, and these people you can trust. They will help you. Kevin can tell you how many vaccines we've been able to give out because people are barriered around getting to clinics and and they're afraid of clinics as well. They're worried. Everybody's always worried about judgment. Will they look at me? And have assumptions about who I am. And sometimes you need that longer conversation if you're vaccine hesitant around, COVID or the flu or tetanus or any of those things. And you've got the paramedics, you've got Robyn and her team to just have those demystification conversations. And it makes healthcare safe and approachable as well.
We certainly what you're describing is critical. On an earlier program, and correct me if I have the numbers wrong, but I heard that there were 33 fatal overdoses in 2021, and the numbers are going up. Now, that's not the near fatals that I'm sure, Kevin, you and your team respond to as well, but those are people who've actually died. So your pilot program may not actually be a pilot. You're describing an absolute critical ongoing need, and one that I think the community needs to certainly be even more aware. What have you learned that you didn't expect as a result of this? What surprises? And I'll just ask anyone who wants to respond, or all of you, that has either changed, as Kevin said, how he approaches things, or how the service is going to get delivered now or in the future. Anything shock you?
Carol, I think it's around the team delivery, right? We're so used to being in silos in healthcare, and we have amazing organizations, but we're all in our own organization. So I really feel this is the first pilot project where you've brought big organizations, Grey County, United Way, GBHS, CMHA, and you've taken individuals with specialties, nurse practitioners, not to mention the two physicians that we have on board from RAM. They also have their own family practice. So these are two physicians, Dr. Libby Cox and Dr. Carolyn Travers, that really, round up our team from a medical standpoint. We have our two community care paramedics, Sherry Foster and Darren Clock, and we have the other two NPs, Kate Auger and Heather Prescott. So you know, having that expertise, and then you add in the expertise of our harm reduction, Felicia Hunter, and then our navigator, social navigator. This to me is unheard of. We have our individuals' organizations, but now we're all in the same area at the same time, and we're lending all of our expertise without fighting over money and stats and who's doing what. It's we're working together. And to me, that's what healthcare is supposed to be. It's avoiding emerge department visits or readmissions to hospital. It's treating patients where they're at, using language that's safe and friendly, and having the expertise right there and then versus the wait times. Because I think with COVID, everybody is just over the wait times, right? Everybody's so behind.
That meeting starts at 2:30.
So to be able to deliver that service now and, you know, get people connected and not lose them, I think is really important, and what I've learned about the importance of partnership.
It comes back to those social determinants of health. You know, where you know, the income of your family when you're born really often is the trajectory of your life, and health is related to your income level. And this is addressing those social determinants of health.
And I can't help but think how rewarding it must be for all of you who are dealing and we're trying to address these issues, to be able to have that experience of what it's like without the silos.
And that's one good thing about this is the partnerships, Carol. Like there's 4 of us here of 4 organizations, but like Steph said, there's well over 12: Public Health, OSHARE, Salvation Army, YMCA, the County of Grey, County of Bruce, the Wickadong, the SOHAC, you know, the town of Hanover. Like it just goes on. And we talk about, you know, what surprised you. A couple things. One is the demand for the service that we have, and we can talk later about stats. But when we were coming together after, you know, the initial emergency, the amount of people that wanted to help, like when we were setting up for Owen Sound, we were concerned we might have too many people in the building that might prevent people from coming in. And where in healthcare and non-government organizations do you have so much willingness to help where you're concerned that maybe have too many people? What a great group of people.
So I'll go to Stephanie because I'm wondering from your perspective, and then let's talk about stats, because who gets the stats, and obviously they're important. So Stephanie, from your experience.
I think I would just echo a lot of what's already been said. And I think what stood out to me the most is the very obvious beneficial impact that the work is having. So we've got the stats to back it up, but we also have stories, and you can see people experiencing wellness through these interactions. Something that really stood out to me when we were supporting the rooming house was by the end of that quarantine period, because people had been able to access the supports they needed, probably for the first time in a long time, people were healthy. Wow. So it was, you know, interesting to see how having COVID-19 in the end actually left people nourished and hydrated. Wounds were healing. People were able to access addiction medicine and make changes to how they were using substances, access mental health care, and the outcomes were visible. It was palpable. And that was really inspiring and I think motivating for all of us. So when the opportunity, or when we created the opportunity, I guess, to continue this and expand it from Hanover to Owen Sound and now across Grey County and hopefully into Bruce County, everyone was eager because we saw that it worked. Yeah. There was no doubt.
We have 3 minutes approximately in the program. I can't believe how fast this has gone. Can you give me some stats?
Yeah, sure. So we look at it from a fixed site where we're in Owen Sound and Hanover. So we also look at the mobile team, which only started really on the road on February 2nd. But for the fixed site where we've been in Owen Sound since October, we've had 600 visits. So this is every other week. And for the fixed site in Hanover, we've had over 200 visits. And again, each week that's over 10 agencies working together at those sites. And then for our mobile team, they've just been working like no tomorrow. They're working hard, let me tell you. And they've seen 175 visits in the last 2 weeks, and 127 new people they've seen and 48 repeats. So there definitely is a need out there, and they're making these connections. And it's not about the number of connections, and we talk about that all the time. It's about, you know, getting those relationships and getting the returning relationships. So yeah, like there's definitely a need, and there's definitely a willingness of the team to reach out and extend a hand.
The fact that there are new connections as well speaks so much to the value of having the services where individuals can access them in sort of one spot. And it reminds me, Francesca, I'm sure in other conversations you've used the phrase "no wrong door."
Yeah.
And this is an example of no wrong door. Maybe you can just, for the last minute, maybe talk about that concept.
So this is perfect example of no wrong door, because when you see the repeat people and then they bring others, that's the building of trust. And they may have varied needs and complex needs and needs that are not on our agenda, but they go, hey, these people will start us on a journey. These people can help solve. So this is where we're going to start. And when they approach anybody in the team, it's not like, well, that's not our department. That's not our job. That's not what we're working on. It's okay. What's going on? And who do we know, and who can we tap around this and solve this problem? And that's what the basis of no wrong door is where you land, where you end up, and who you're talking to is the right person at the right time. And then it can flow from there. And then if there is a soft handoff to somebody else, because it definitely belongs somewhere else, then that happens. And then there could be a follow-up, how's it going with that other agency? How are the connections going?
Yes. And so although you describe the role of an individual as a navigator, and what you're really saying is all of you are navigators, because you're helping move people through the system, certainly where they need to be. So your goal is to continue. Obviously, you'll need funding and encourage people to support this program through funding. And obviously, as we said earlier, COVID has been rough. But there is a silver lining in this program that will serve our community ongoing. So I want to thank all of you for what you're doing, and also for being on the program today. Our time is up. So thank you to everyone, and keep up the great work. And please come back and speak to us again. This is an open invitation to appear on the program again to update us. Thank you to our viewing audience for joining us today. Please join us again to learn more about programs and services available to you and to your family. Take care and stay safe. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
I'm a right winger with the Owen Sound Attack. Get great OHL action on Rogers TV as we bring you Owen Sound Attack games live, both home and away.
Calling all journalism students. Omni Television is once again awarding scholarships to qualified students pursuing a career in third language journalism.
When I found out